welcome you all to today's webinar. This webinar is on advancing healthcare quality and workplace improvement through the 5S, 6S methodology. It's an exciting topic that I'm sure we are all eager to delve into and gain more insights. Kindly, if you're not muted, please mute. This webinar is brought to you under the Healthcare Quality Series. This is webinar number 3, and we're excited as the Kenya Quality Partnership to be able to increase capacity among healthcare workers in this area of quality healthcare and healthcare improvement. The Kenya Quality Partnership is composed of the Kenya Medical Association, the Society for Quality Healthcare, the Kenya Association of Private Hospitals, and the Rural and Urban Private Hospitals Association of Kenya. I am your moderator for this session. My name is Dr. Brenda Obondo, and I currently serve as the Chief Executive Officer of the Kenya Medical Association. Just a bit of housekeeping. Kindly reserve the Q&A section for questions only. If you'd like to make comments, please put them in the chat box. The team is checking in. And we'd also like to recognize this partnership supported by KNH-UON to be able to host us for this CPD session. CPD will be awarded for this session as per your registration details, and the recording will be available on the KNH Research YouTube page, as well as the KMA YouTube page. Karibuni sana. I'm hoping I can have my video on. And as the host is looking at that, allow me to introduce our speakers today. Today, we are privileged to have the presence of 2 speakers. We have Mr. Milan Ochieng, who is the Quality Improvement Officer at PCH Ogoria. That's in Tharaka Nithi County. And Milan is a quality practitioner who is going to be introducing to us the 5S, 6S methodology. And we'll have Christine Ondere, who is a midwife at Matata Hospital in Homa Bay County. Christine is also going to share with us some quality improvement strategies that they as a facility have been able to put in place. So karibuni sana. I'll allow the speakers to just say one word before we proceed.
Good afternoon. My name is Milan. It's a pleasure to be here, and we hope to have a fruitful conversation about advancing healthcare quality and workplace improvement. Thank you.
Thank you, Milan. Christine?
Good afternoon. My name is Christine Ondere. I'm privileged to be here. It's a pleasure to meet all of you. Hoping to have a fruitful discussion this afternoon. Thank you.
I'd also like to recognize a few members of the Kenya Quality Partnership who are present in this webinar. And Dr. Mike Mulongo, would you kindly just say something before we start the webinar?
Thank you very much, Dr. Brenda, and our able panelists, and the KNH team, and all the collaborators that are present. It's a pleasure to see this series taking shape. Much gratitude to the teams behind this. I also see Peter Mutanda, he's part of the education committee, the Society for Quality Healthcare. We acknowledge the support that you provide, and we look forward to a fruitful discussion. Yes, thank you very much, Brenda. Over.
Thank you, Dr. Mulongo and Peter. Karibuni. Thank you for those of you who are already engaging on the Q&A. Kindly let's reserve that for questions. Let us comment and engage on the chat. Asanteni. Milan, I'd like you to start by introducing this 5S, 6S concept before we get into the different strategies that Christine will be able to share with us so that we gain a better understanding. So Milan, I'll hand over the floor to you. Karibu sana.
Thank you. Is my screen visible?
Yes, it is. You can slide share, slideshow.
Is it there?
Not yet on slide share, but
on my side, actually, it was. Let me just do that again. Is it?
yes, I think you can zoom in, then proceed.
Okay.
Yeah, it's not on slideshow, but you can zoom in and proceed.
Okay. So as correctly put, my name is Milan from Chogoria Hospital, and I want to introduce this topic is basically advancing healthcare quality and workplace improvement using 5S and 6S. Edward Deming says that quality is everyone's responsibility. As such, I know that we are basically hosting a number of audiences and participants of various backgrounds and professions, and therefore it's a pleasure for me to be able to take us through this. Now, a small study was done, and basically the following questions were basically asked between medics and
Sorry, Milan,
pilots.
allow me to interrupt.
Yes.
Your slides don't seem to be moving. Okay, now they are.
Yes.
And kindly zoom in. We're not able to view your, yes, I think slightly less.
Yes.
Yeah, that should be fine. Thank you.
Okay. So maybe this slide is familiar. A small study was done, and basically this was basically giving a safety culture comparison. And this study showed that between pilots and medics, if you look at basically if negative impact of fatigue basically affects their performance, you can be able to see majority of medics believe that fatigue is not a very big factor, yet doctors would be able to put safety and risk at agree that that is a big issue. Then basically looking at rejecting advice from juniors, you can see 3% agree that they reject advice from juniors, so they take advice from juniors seriously, compared to medics that basically only 45% agree that they take advice from juniors. If you look at its error analysis system-wide, you can be able to see 100% done, so they take safety very seriously, compared to medics that basically gave an agreement review of around 30%. Do you think that you make mistakes? 100% doctors say they make mistakes. Medics believe in themselves, and therefore 30% only agree that they make mistakes. Is it easy to discuss reports of mistakes? 100% for the pilots, they know that mistakes, a simple mistake is fatal. For medics, it's 56%. So basically, as we start this conversation, I'd want us to get to a point where we can get advice from a junior also look at system issues that we have in our facilities, as well as know that there could be mistakes that have been identified within our systems that we need to be able to address, but also that we will be able to, going forward in sustainability, be able to discuss reports that will be able to come from the quality department or quality improvement teams. Now, this session is basically going to discuss the 5Ss plus 1, that is the safety, and basically mention the importance of the 5S and safety, listing examples of activities that we could be able to do to be able to improve on our workplace safety. So there are 4 purposes of improvement, and these purposes are basically to make work easier, better, faster, cheaper. And these 4 goals appear in the order of their priority. So the first one is basically to make things easy, and that is where the 5S comes in. And then once that is achieved, then we get to standardize, and that gets faster. And then the wholesome game in terms of the sustainability is to be able to make it more affordable to the patient. Now, 5S is a philosophy and a way of organizing and managing the workplace and workflow with the intent to improve efficiency of work. Now, with the focus now on safety, a 6th S, which is the safety, has been advanced, and basically you'll be able to note that the relationship between the 5S and the 6th S is basically all about safety. So this can be used not only at work, but also at your home. When you're leaving to work, sometimes you miss your socks because you didn't know where you put your socks, especially for the male gender, among other things. So this basically helps you get organized to be able to get to work even faster. You know where you put your keys, among other things. So if that is well organized and arranged, then you'll be able to see in due course, as we discussed, that this is something you can basically practice at home and also bring IPC also at home. So it is the foundation basis for all quality management systems and the starting point for continuous quality improvement. Now, there's a history to 5S, and it is believed that some believe that it goes way back to the 16th century, almost when you're talking about the Venice shipbuilders, among other things. But basically was developed in a car producing company as a workplace organizing method. Japanese Toyota and San developed the 5S methodology, or what is called the total production system after the World War II. So thought to be utilized by Toyota in the 1970s, and therefore we are being invited to also try it to be able to see how this works for a healthcare institution. So as I said, it's the basis at the bottom, then you go to CQI, and then you move to total quality management system. Now, what does the 5S plus 1 mean? So basically it represents a number of items. So sorting, there is setting, some say straightening, then you have shining, then we have standardizing, then we have sustaining, and then now the 6th S, which is one that crowns it all, basically safety. So in the sorting, so basically these 5 steps, we'll be able to look at them in the order that we have been able to mention them. So sorting is to remove and use color coding these items. You develop an inventory list. What do you have in that particular list? Remove all unnecessary items for discarding, store, or keep those that may be needed at some point. Regular sorting is also done on this particular unused items to be able to continuously go through this particular cycle, so that you develop a culture of returning items to where they belong, so that people can easily identify, pick them, use them, return them. So can see, can pick, can take, and return. So basically that particular flow needs to be very consistent. Now, in sorting, you also eliminate unnecessary, no longer up-to-date guidelines, policies, SOPs, tools, parts, instructions that you have in your department or in your health facility. Now, this addresses the notice boards. Some of the notice boards we have got 1992 posters, calendars, among other things, that just clutter the nursing station notice board or any other pathway notice board. And therefore, even the essence of that particular notice board, including the work instructions, is not visible because they are covered by a notice some announcement that is obsolete, but it's still on the notice board. So regular sorting of the notice board helps make sure that up-to-date work instructions, guidelines, policies, SOPs, tools, instructions, communications are available to be able to make sure that that notice board is properly utilized. And also, this also goes way deep into also the guidelines that we have. Some of the instructions are speaking about offices that maybe have been surpassed by time and events, but then we have not adjusted to be able to fit to the current scenario and circumstances. So this sorting of our SOPs makes sure that we have got very current information, and that has been surpassed by time is basically removed from our SOPs. So keep only essential and up-to-date items in those particular SOPs and notice boards, and eliminate what is not required, prioritize things per requirements, keeping them in easily accessible places, and everything else is stored or discarded, depending on that particular priority. Now, you can see this is a ward. I know this is a scene that if I went to any of this facility, I'll be able to see some area that they keep this linen and they are not using them. The linen team sends them to a repair place, and the repair place keeps them there. Some of them are either not fit for use, among other things. So this is one of the hospitals that we were able to visit for a joint audit, and we were able to see this, and from the 5S, they could be able to find what was usable and what was not able to be used. Now, I'll tell you that this hospital was able to partner with the facility in Thika that was basically utilizing recycling of linen. So you can see you can make money out of the sorting process. Now, I'll also give the scenario for Chogoria, that Chogoria was able to do sorting of items, and when they sorted their items, they were able to auction unused items, and the auctioned and used items that will never be used items was able to raise revenue that was even used to be able to help do a roofing structure. So you can be able to see that you can make this business concept to be able to fundraise and raise resources that can be able to fund quality projects. So this is just one of those examples. Now, setting is to organize all necessary items in proper order for easy service provision. So organize cabinets by labeling and numbering them, keep items in their respective areas and label them accordingly. Directional signs, we take them for granted, but you see, when you're talking about issues access to healthcare, you'll be able to understand that directional signs stand a very, very important, provide a very important service of basically making sure that the patient receives services in the right place within the shortest time possible. So leading to service areas that we want. So basically also labeling the service rooms, updating stock and basically equipment inventories. So this will be able to help us to be able to do the setting. Now, arranging up-to-date guidelines. So basically making sure that our guidelines are up-to-date, our policies that we have are the ones that we need, frequently used items, making them easier and quick to locate. And the purpose of this particular step is to eliminate time wastage in obtaining the necessary items for the operation that we basically want to execute. Now, you can be able to see this as an example in a store or say pharmacy, nutrition unit, and basically the CCC, for example, they receive these food commodities and therefore or prescription or drugs and supplies. And if you don't basically look at the maximum piling height limit, therefore you end up having risks of falls and also damages that could also be caused. And these ones are this defective occurrence or incidences lead to high cost. So this is something that we can be able to see that if we organize these particular boxes properly, then we are both safe, but also we minimize the risk of cost that could be able to come as a result of the same. Now, sometimes we get to our casualty or get to our areas of service and we don't even know where to get the trolley bed. This is because it has been left somewhere in the corridor, it has been left somewhere in the pavement or waiting bay. But if you can see, if it is well demarcated and it is well known where the trolley sits, then everybody can be able to access it quickly and help save a life. So this is something that you can be able to see. Color coding the same, when we are basically doing decontamination of basically equipment or linen, whatever thing that you want to be able to do that, you can be able to see when it is clearly identified. People know what exactly is where, and therefore we will not have the risk of doing the wrong thing. So basically, labeling and zoning of that particular items helps also make sure that that surface area is neat. In our facilities, sometimes you'll be able to find spillages because these particular items were not put in the correct place and people were not keen to be able to make sure that happens. You can be able to see the records unit, where you'll take 20 minutes to be able to get a file for the patient and retrieve it for purposes of medical records. You can be able to receive this particular document in 20 seconds if it is well done. So SHINE is to maintain high standards of cleanliness, routine cleaning, and mass campaign for making sure that the facility has a breath of fresh air. Some of the places we are in as part of cleanliness, we are so keen in providing drugs and medicine, and we forget about the dusting processes, the cleanliness of the environment that we occupy, because of both IPC and also occupational health and safety of our patients. So basically, this helps us maintain high standards of cleanliness, and therefore cleaning is not only for the places that we basically see that comes to our view, but also the places that are under the furniture, under the equipment, and in the hidden places that we basically operate in. So it has to be intentional, and therefore that is part of the 5 S's. So internal and external customers, and here I'm referring to the patient and the caregiver, will appreciate clean and attractive environment. And this is something that we must say, that the hospital of tomorrow is going to have a competitive edge in terms of hospitality services and cleanliness, as opposed to the other variables that we'll be able to consider, in as much as they are also important. So clean and workspace and all equipment needs to be kept clean, tidy, and organized. At the end of each shift, each person must be able to make sure that their work surfaces are clean, and they must be sure to be able to make sure that everything is returned in the space that they basically got them from. So individual cleaning responsibilities has to be assigned to make sure that people know that cleaning is part of their job description, to be able to make sure that their work surfaces are sanitized or work surfaces are clean. So making clean and inspection needs to be easier if we make sure that we do this as a habit. So clean the spaces that we have, so that we make sure that we also remove notices that are not wanted, we remove posters that are not required, and make sure that cleaning inspection and minor problems are basically corrected in the spaces that we basically operate in. So in Shining, you can be able to see the first picture is of a kitchen somewhere. I'll not say where. So if you see this, it relates to your space, know that you are mirrored. So this was the one hospital, and therefore you can see that this has everything to do with how we make sure that the chain system thinking, and we basically provide the best outcome for the patient. So these other service providers can do everything right, but one particular space is not tidy. So in Shining, we must make sure that every other space is as clean as the other space. So we can't have a sterile theater, but we have a kitchen that needs improvement. So this is something that we must be able to look at in the system thinking and the holistic view of how to be able to do this. Then standardize is to set up the sort, set, shine as a norm in every section of the facility, and develop work instruction, SOPs, standards, regulations, rules that you basically are using, employees doing the same job that should be done to make sure that their stations are as per how they basically need to be able to do it. And basically, they should know exactly what is their responsibility. So these employees need to be able to know that. Now, establish procedures, plan activities, make them visible, follow them up, and document. So basically make these particular SOPs work for you. So sustain is to train and maintain discipline of the health workers. And here we're basically applying self-assessment. We are also doing quarterly 5S and safety audits, and basically implement improvement activities, review the standards, and also make sure that before we get to sustaining the 4S, the previous 4S has already been done, and we are working on them. and basically have a new way of operating, basically doing an organizational culture, and this is a part of you. One of the beautiful ways of how to sustain this is to be able to reward and make it a habit. And when you do the audit, provide feedback and communicate in diplomatic ways on what your findings are, and have an involved method of basically improving on the areas that you have identified that needs to be improved. Now, implement audits. You can do them monthly or quarterly, depending on how you want to do it. Make 5S habitual and promote the 5S culture +1. Use 5S at home. So if you can't practice it at home, you can't practice it at workplace. So start acting clean at home. Start making sure that you are also 5S sorted at home before you can be able to come to a workplace to be able to make this happen. And this can only be done when you've also done 5S in your brain. You basically also sort your brain up, make sure the files that you need to prioritize are also done in that manner to be able to make sure that this is adopted. So the areas that are red flagged, or the areas that you find that needs improvement, you can basically put this red tag. And this red tag is to be able to help identify what needs to be improved, and then it will be improved in successive methods. There's a 5S audit that you can use. There's a checklist that you can be able to get from the society. So this checklist, you can be able to use it to be able to score. And the photo just next is of a team that was basically doing an audit of the 5S in a pharmacy. So you can be able to see multidisciplinary involvement of staff to be able to participate in this particular process. So the sixth one is about safety. And when we talk about safety, we're asking, what is patient safety? So the reduction and mitigation of unsafe acts within healthcare system, and as well as the use of best practices shown to lead to optimal patient outcomes. So here we could be able to have a lot, there's a whole concept on its own, and we are basically looking at a number of things that could be done to be able to minimize errors, and also to be able to reduce risk, reduce harm that would be coming to the patient way if we don't do the 5S, and therefore safety sometimes gets into trouble. Now, here we are looking at issues of patient safety is most concerned, the issues that we are basically looking at when we talk about patient safety. So medication errors. We are also looking at healthcare-associated infection and safe injection practices, diagnostic errors and safe transfusion practices, radiation error, sepsis, among others. So these are areas that you'll be able to look at. African nations adopted the 12 patient safety action areas that you basically are probably aware of. So patient safety and health services and systems development. You have got also the national patient safety policy. There's also knowledge and learning in patient safety. There's also patient safety awareness raising. There is healthcare associated infections. There's healthcare workers protection. There's also healthcare waste management, safe surgical care, medication safety, patient safety partnerships. There's patient safety funding, patient safety surveillance and research. So you could be able to also refer and look at this. Kenya has also adopted Kenya's national patient safety goals. And basically, this basically looks at prevention of healthcare-associated infection, improve the accuracy of patient identification, and this also looking at improve the effectiveness of communication among caregivers, improve medication safety, use of alarms, identify patient safety risks, prevent surgical mistakes. Now, if you look at these particular goals, you'll be able to see that it has everything to do with 5S. From the hospital infection, you saw the color coding for purposes of making sure that we decontaminate the equipments or disinfect the equipments or items that we basically use, from sorting of color coding of the waste bins and making sure that they are visible and are also identified. There's an SOP that shows us how to use them, and also looking at patient identification. And you've seen how those labeling and directions are also very important, and also effectiveness of communicating. And that goes with the notice boards and how we communicate. And we've also looked at medication safety. If we label the drugs correctly and label the shelves correctly, then this also goes a long way. If you go to our DDAs, they need sorting because there are drugs that are put somewhere, but sometimes we don't open those, and because they're under lock and key, sometimes we use them as a guise to be able to keep the rest of the world away from viewing how we have correctly identified those particular medications. And when we need what, we can be able to pick, see, save life. So this is something that you can be able to see how this relates directly. So we have benefits of ensuring patient safety. Of course, the safety comes first, making a good progress towards effective UHC provision will basically also reduce cost as very good benefits that you'll be able to see directly on issues safety. So there are targets in 5S, and this is basically having a zero changeover when we keep having varied services and varied points of say the trolley, for example. So when it takes nurse X 10 minutes to get the trolley, and it also has got nurse Y 2 minutes to get the trolley, because this can save life, and this also has got service specialization. So everybody else knows that at Chogoria Hospital, the response rate to be able to get your trolley is to be able to go to like 2 minutes or 1 minute or less seconds. So this is something that will be able to improve on specialization. I've just given that as an example. Then you also have zero defects, leading to higher quality. We also have zero waste, leading to lower cost. We also have zero delays, leading to on-time delivery, and also zero injuries. We also have zero customer complaints, because sometimes when you have obstructions in the walkways, this also leads to customer complaints, among other things, or they can't access the wheelchair. So they don't know the designated points where the wheelchair is labeled to be able to be put, among other things. So zero breakdowns. And also we have got zero red tags to be able to identify the eyesores, the areas that needs to be improved. Now, 5S+1, we have got critical success factors. Number one, for us to succeed, we must get management involved. Number two, we need to be able to get all staff involved. Number three, we must apply sufficient resources and be deliberate in this. Number four is to be able to have regular audits for this particular activity. And then we can be able to recognize and reward the departments and units that have done well in 5S practices +1. Now, their importance, basically, we have the workplace gets cleaned and better organized. The hospital and office operations becomes easy and safe and faster. We also have results are visible to everyone inside and outside. We also have visible results that enhance the generation of more and new ideas. We also have people with will be proud of their cleaner, organized workspaces. As a result, the healthcare facilities image will also generate more business. And I told you that is where the competitive niche will be. And then we also have, it's expected to instill a team culture, increase morale, motivation, and improve job satisfaction. I said again, then we also have basically as a summary, having it pleasant, efficiency in workplace, and the 5S, if it's done, safety comes automatically. So then we also have leads to better customer satisfaction and better time management. Now, I'll basically say this, and this I have mentioned previously. You can be able to see, and I'll just be showing you examples. So you can see how this records department looks like. Again, this is not Chogoria. If this is your facility, you can own up. So this is one of the hospitals that we were able to visit as a quality team under Christian Health Association of Kenya. And we basically see this as one particular records place, but then they were able to well organize. So you can see you cannot easily get the patient records from this particular records department, among others. So this is a pharmacy store. You can be able to see that happening. Again, disclaimer. And then you can be able to see this. So this is the difference. So you can be able to see that you can easily get the plastic tape from store 2 compared to store 1. You not know what to be able to pick from where. And that reduces your turnaround time. And that has got an effect on complaint of patients and also the safety of patients. This is an example of a red tag that you can be able to use. You can see how alignment, you can see the suction machines, among other machines, and how they are properly labeled and arranged in order, and therefore that makes a whole sense. A records office, you can be able to see it takes a shorter time to be able to get things that you need. You can see your drugstore where you can be able to get the items you need. You know, you need a 5%, you know where they are, among other things that you can be able to see. Look at those notice boards. There's notice board A and notice board B. A is not communicating. B is beautiful and therefore communicates, and you want to be able to read. Sometimes you have old calendars, notices, that are not useful. So tidiness is very important. You can see where the trolley is well demarcated, and therefore everybody else knows where to put the sharps container, among other things. So zoning, and therefore that goes a long way. Identification of sites for safety, very important. This is part of 5S, because when you label, people know where to get what, people know what cautions to take, and this also improves both patient satisfaction and safety. Understanding the meaning of color code. Sometimes you can be able to put an SOP to be able to guide people to remember what those colors mean, and therefore that goes a long way. Still signages, directional signages, increases issues of access, but also helps people get services in the right place that they required. Again, you can be able to see how mapping goes a long way. Sometimes you also use a symbol to be able to help sort patients very fast, because if this signage was on a washroom door, it helps show that the person who gets in here is somebody with disability, and therefore priority will be given to that particular patient. And this particular patient knows where to get sorted out because the signage have been able to communicate. So sorting also goes in that particular manner. So you also can be able to establish a notice board corner or a Kaizen corner where you basically also communicate improvements that you basically also want to be able to be achieved. In summary, now we've said that we sort, clearly distinguish needed items from unneeded, and eliminated, and you eliminate the latter, you eliminate those that are unneeded. Then you also go to straightening, and here you keep needed items in the correct place to allow for easy and immediate retrieval. And then you have shine, keep the workplace neat and clean. Standardize, you basically perform all the 4 before, the 3 before, sort, set, shine, and make this habitual, and then you sustain. So sustainability, you maintain that particular culture and habit through audits. But then there is a plus in the middle, safety. So safety strengthens the whole of this particular concept. If we are keen about safety, then the 5S would be able to come in automatically. Now, quality is never an accident. It is always a result of assertive, consistent, and steady effort. So this has to be deliberate for us to be able to achieve what we have purposed to be able to achieve. And thank you very much.
Wow. Thank you so much, Milan, for sharing that very practical approach towards quality improvement. I'm sure those of us in the room were taking notes on what we can do even within our departments to be able to improve that process. Thank you for also keeping time. I know I was looking at your 56 slides, but you've broken it down very easily, and it's easy for us to understand in a short period. So if you'll allow, I'd like us to please post our questions in the Q&A, even as I invite the next speaker to take us through the next part of the session. I'm noting your questions and your comments. For those of you who are requesting for the slides, the speakers will be able to share with us, the KNH team, and they'll be able to share with you. Those who've requested, we've taken note of. Sorry, I was talking while muted. I'd like to invite Christine, please. You're welcome. We are looking forward to hearing what you're doing at Matata Hospital, so that we can also take note of those strategies and quality improvement steps. Karibu, Christine. Kindly confirm if you're able to share.
Mike, are you able to share? Yeah.
Continue to place your questions related to the presentation on the Q&A. The presentation, once made available by the speakers, will be shared to your email. So I think we can avoid those queries in the Q&A. We shall share, once made available by the speakers, we'll share with all the registrants. Yes.
Hi, Dr. Brenda. Let me share on Christine's behalf. Mike seems to be away. Okay.
Okay, no problem. Milan, an anonymous attendee says that was a very clear and precise presentation. Asante.
Just confirm if you can see my screen on shared.
Yes, kindly, if you can place it on, perfect. So Christine, over to you.
Thank you, Dr. Brenda. Thank you once again, Peter, for assisting me with the sharing part. Okay, once again, I'm Christine Nyalesondere, and I'm going to discuss about the advancing quality improvement in family planning services that we did in our facility. So it will be a short and precise presentation. So we have a few initiatives that we took in order. So this was part of our improvement aim. So our improvement aim was to improve the immediate postpartum family planning services that's within 48 hours at Matata Hospital from a baseline, which was from November 2022. So the baseline was at 2%. So I'll say a brief introduction of our county at large and our hospital. So we realized that Homa Bay County had unmet need for family planning at 17%, according to the Kenya Demographic and Health Survey that's in 2022. And so our objective was to enhance immediate postpartum family planning services within 48 hours post-delivery. So I'll share a brief introduction of our facility. It's a private hospital and it's located in Oyugis Town and in Rachuonyo sub-county in Homa Bay County. So it's a level 4 private hospital, and we have an average of 110 deliveries in a month. And we realized that the postpartum family planning uptake has been very low. And before the interventions, the baseline was at 2%. That's from November 2022, according to the Kenya Health Information System. So the predicted impact that we worked on were to increase the postpartum family planning uptake. And so our future prediction was we are going to expand the interventions to reduce the unmet need for family planning need among the clients. So basically what we did, we had capacity building initiative, which was followed up with quarterly support supervision to access the skills, the mentorships, the coaching to the facility. And we also had work improvement teams. And we also enhanced the learning sessions, bringing together other implementing facilities. So we had several gaps that we noticed that were contributing to the low uptake of PPFP. So what we did, we used a root cause analysis to identify our problems. So we used a fishbone diagram to identify and analyze the problem. We came up with very many root causes. So we placed them under supply gaps and demand gaps. Some of the few gaps that we noticed, we had high staff reshuffling and turnover. We had knowledge gap on the use. So we decided to work on 3 that brought about the change ideas and were adopted by the work improvement teams. Therefore, I'll briefly talk about the 3 problems that were identified and their root causes. One of the main problems that we identified was knowledge gap on postpartum family planning counseling and the skills by the healthcare providers. And it was on family planning information by clients. We realized that this was due to lack of mentorship among the staffs. We also realized that that was also due to high staff reshuffling and high staff turnover. We had inadequate IEC counseling materials like the MEQUILs, the BCS Plus cards, the flip chart, the tier charts. And so we had issues with knowledge gap. We also realized that we had an issue with the stockouts of family planning commodities, since we were also being supplied from other partners, and we also had inadequate postpartum intrauterine device kits. Another problem that we identified was lack of male involvement in postpartum counseling and services, and this was due to knowledge gap among the clients on postpartum family planning within 48 hours. And it was also due to lack of awareness. You find that most of these mothers who come to maternity, they'll first inquire from their husbands before being provided for the services. Another problem that you identified, we had inadequate information of postpartum family planning within 48 hours by the clients and the community at large. And this was, we realized that there were myths and misconceptions in the community on family planning. And we also had irregular health talks at the various service delivery points. Initially, we had 1 in a week or 2 in a week from MCH to maternity. So what we did, we started doing the daily health talk. We also realized that we had competing tasks among the staffs leading to burnout, which was one of the causes that led to low PPF, postpartum family planning. So what we did, we decided we are going to set on interventions and the change ideas that are going to help us on managing the problems that were identified. So what we did, we used a plan, do, study, that is a PDSA cycle to describe the changes, their ideas, the implementation, and we also did the testing of the changes to see the effectiveness. That is the measuring point. So we tested on 3 change ideas that brought about the desired change and were adopted by the work improvement team. One of the interventions that we tested on was mentorship of healthcare providers on postpartum family planning services within 48 hours. So we were to test if mentorship will increase service providers' acquisition of knowledge, attitude, and practice to provide immediate postpartum family planning services. So what we did, we divided it into several parts. We were to identify, to prepare, and also set the sessions. One of the things that we identified were the gaps. We realized that we had knowledge gaps. So what we did, all the service providers identified the postpartum family planning skills knowledge gap. The second thing, we also identified the mentors who went for training. So we identified the mentors within the facility and were trained on postpartum family planning alongside the sub-county mentors. So what we did, we prepared a venue in maternity, postpartum family planning counseling room. We also availed the materials and the schedule developed and responsibilities allocated to the mentors. So the session started from January 2023. So on the sessions, we had 2 sessions of 1 hour, 30 minutes each every afternoon. On the assessment, we decided to conduct an assessment after the sessions. So what we did a pre and post skills tests, and we rated them out of 10. We had to track the mentees. So what we did, we tracked the mentees for 3 months. So our main prediction was to see if mentorship of the service providers will increase their knowledge and competence in the provision of immediate postpartum family planning. So all these interventions that we did led us to the measuring of the mentees. So what we realized, 60% proportion of service providers were demonstrating skills and competency in postpartum service delivery. Eventually, all the mentees were able to demonstrate the skills. So what we did, we decided to adopt the change idea which has helped us in postpartum family planning. Our next intervention was on couple counseling for family planning services. We were to test the effect of couple counseling on maternity on postpartum family planning. We realized that most of the clients who come, they have to consult their spouses first before they partake the method. So what we did, in December 2023, we designated a room for couple counseling since we realized that privacy was a key issue in our facility. So the room really helped us in counseling the couples. We also availed the tools like the MECWILs, the BCS plus cards, family planning handbooks, the charts to do the counseling. And service providers were designated on rotational basis for a daily couple counseling in maternity. We provided a daily routine schedule and a roster to do that. So the counseling approach that we used the tools to address the misconceptions and support decision-making for couples. We did this to see if the couple counseling will increase the uptake of postpartum family planning within 48 hours by 60%. So what we did, the intervention that we did, we improvised a register. We took a black book, we improvised it. So what we captured on that book, we captured details of spouses counseled and the methods chosen by the spouses. We also did a tracking by weekly work improvement team meetings, that's review meetings. We also tracked on the number of couples counseled, couples who accepted a family planning method, and the specific method that were chosen by the couples. So with this, there was an increase in uptake of postpartum family planning, within 48 hours, as shown in the run charts below. So therefore, the change idea was adopted, and it has helped in enhancing family planning. So our third intervention was daily health talk. We were to test if the health talk to clients will improve their knowledge on immediate family planning uptake within 48 hours. So therefore, we conducted a meeting. So as staff at large, we convened a meeting to emphasize daily health education for all the clients. That's to all the healthcare providers in Matata Hospital. We also did a health education schedule with dates, times, topics, and responsible persons, which we posted on our wall, on our WhatsApp, on our media wall for all the staffs. And we also placed some on our board for efficacy. Another thing, we started the health talk, targeted health talk, daily health talk in February 2023. Initially, we were doing on alternate days, but we realized that we had missed opportunity for the information, postpartum information. So what we did, we decided to do a daily targeted health talk, especially on family planning. And we conducted this daily from 9 a.m. for 30 minutes. We also did conduct exit interviews for family planning clients to see the reviews and the feedbacks they would give back to us. So we were to predict if the daily health talk in maternity by the healthcare providers will improve the client's knowledge of immediate postpartum family planning uptake within 48 hours. So after this intervention, we realized that there was an increase in the number of clients reporting sufficient information on postpartum family planning within 48 hours, and an overall increase in the uptake of PPFP within 48 hours. Therefore, this idea was adopted and set as a routine practice in our facility. So these are some of the results that we received. We also conducted exit interviews. We received several client interviews. So we decided to take on client feedback, we decided to take the data under the run chart. So we tested on the percentage of clients who felt they were given enough information. This is part of our run chart that we did. On being given enough information, in January week 2, 2023, we realized that we didn't have an increase in postpartum family planning. Initially, the mothers were not aware of postpartum family planning. Therefore, we sat down as with teams. We had meetings. We had review meetings. We had review meetings on data charts, and so that there was a gap in family planning. So what we did, we decided to do a daily target health talk at the maternity, both at the maternity and the MCH. So there was a slight increase in how the mothers felt they were given information after we started the daily health talk. At some point around between March week 4, 2023 to May week 4, 2023, we had a high drop in clients who felt they were given enough information. One, we lacked the clerks who are to administer the exit interviews, and therefore the exit interviews were not conducted. So we sat down as a team and decided that we are going to choose 2 clerks, one for maternity and one for MCH respectively. Therefore, from week 4, we started with we continued with the exit interviews. Around June week 3 and week 4, and October week 3 and week 4, we were not sustaining our graph on clients who felt they were given enough information. We realized that we had less counseling tools. So what we did, we decided to do some lamination, some printing and lamination, especially to some tools like the BCS Plus cards. We had inadequate BCS Plus cards and the MEC wheels. We realized that mothers were not getting enough information at that time. So printing and laminating, and then we decided that we are going to avail at least 4 tools, each tool, identical tool in maternity and MCH. We also realized that privacy was a problem in our facility. Therefore, mothers were not getting enough time and with the healthcare providers to be given enough information, since confidentiality was a problem. So our administration enabled us to get a room, which we enhanced it for counseling. So we designated it for privacy and counseling. With this, we continued with, despite the frequent staff turnover and the reshuffling, we realized that we cannot cap that problem as a whole. So what we decided to do, we were going to do continuous counseling. And this continuous counseling to all the clients has helped us so much. We are seeing a stability on our side, and clients are saying that they were given enough information. So that indicates that our counseling has taken effect. So this process has helped us to know where we are in terms of intervention. Okay, so these are the results of the outcome of postpartum family planning services that we offered. So on our run chart, we were measuring the proportion of women who delivered in the facility and received postpartum family planning within 48 hours. So as you can see from the graph, at some point we had a very low percentage, and at some point we were sustaining our graphs. So we attended, one of our mentors attended this training, which was conducted in September 2022. But as you can see from the chart, there was not much effect between September to November. So by November week 4, we sat down and decided that we are going to form a WIT team, that is work improvement team, both to maternity, and MCH. So that's what we did. And we sat for our first meeting around first week of December. Still at that point, we had a very low uptake of postpartum family planning. So on our first meeting, we sat down and identified the gaps that were being faced in our facility. So we realized most of the gaps that we faced was lack of mentorship among the staffs, lack of awareness on postpartum family planning among the clients, community myths and misconception. What we did with the one staff was mentored between February week 1, 2023. So when one staff was mentored, we realized that there is a slight increase in our percentage of women uptaking postpartum family planning. So therefore, we decided to upscale. With the help of the work improvement team, we decided to upscale to seek support and to scale up our increase in the number of healthcare workers being mentored in postpartum family planning. At some point between April, we had a high increase of postpartum family planning uptake. Initially, we were taking the commodities from MCH and it was kind of hectic on our side. So what we decided to do, we decided to create a room, a storeroom, at least to keep our FP commodities. So we availed them in maternity and stored them in maternity. So this isn't our access to the commodities, and we also never had a register. So we were privileged to be given one register, and therefore documentation was precise at that time. At some point, we still had staff reshuffling and high staff turnover, therefore affecting our sustainability in postpartum family planning uptake. So what we did, initially we were doing mentorship of nurses only. So we had to scale this mentorship to on-site mentorship to other departments, like the female ward, the male ward, the NBU. We also scaled it to clinicians and the doctors. So this enabled us to sustain a high number of clients taking postpartum family planning. We also decided to do a whole site orientation on other staffs in the hospital so that they would preach the family planning, the postpartum family planning services. What we did, we also decided to print placards indicating the free family planning, free voluntary family planning within 48 hours of delivery. So there was a high uptake of family planning due to that. So we've been able to sustain our data due to continuous mentorship and counseling programs. So our prediction as a facility, we noted that mentorship of healthcare workers on postpartum family planning within 48 hours contributed to an increase in the uptake of family planning services, and therefore it has enhanced our family planning method mix. And also couple counseling has really contributed to an increase in the number of women accepting postpartum family planning methods within 48 hours, as there is involvement of partners that has hastened the decision making. Therefore, husbands are also included in this. They're able to make decisions together with their wives on the type of family planning they would like to have and the spacing needed. We also realized that targeted health talks provided a platform to address issues raised by clients in exit interviews, in explaining and clarifying, and also improving the quality of services in family planning. And also all the health talks contributed to an improvement in the client's knowledge on postpartum family planning. There's an increase in the number of clients reporting to have been given enough information. So we as Matata, being a private facility, it therefore means that collaboration with the public health system and implementing partners has been key in provision of quality services to the community. So, some of the key takeaway home messages that we are passing across, we realize that under support and coordination, the hospital administration, the county and the sub-county health managers and implementation partner, that is the Momentum Country, Global and Leadership support, coordination and accountability are crucial for success in any implementation and initiative. We also realize that multi-channel integrated approach, that is the project that demonstrate the feasibility of an integrated approach to improve the postpartum family planning in a level 4 private facility. Strengthen postpartum family planning counseling for all the service providers by enhancing counseling. You start right from the ANC. By after the client has been counseled at the ANC, we chat it in the booklet. So we have also focused on immediate postpartum family planning uptake, and this includes a full range of contraceptive options that are being offered. Health spacing education has been a great benefit on our side, as it has benefits of healthy spacing of pregnancy and addresses concerns about family planning side effect methods and their side effects. These are some of the activities that were done in our facility. Like the first picture is a picture of mentees being taken through skills and demonstration on postpartum intrauterine device and postpartum hormonal intrauterine device. That was conducted on October 2023. On our second picture, you can see a mentee is performing a skill return demonstration on the postpartum IUD and postpartum hormonal IUD within Matata. That was also in October. You can also see there was a sensitization meeting of all the staffs on immediate postpartum family planning. We also included our subordinate staffs on preaching postpartum family planning. So we would like, as a facility, would like to acknowledge the following for their continued support that they've offered to us. One, I would like to send my special gratitude to our staff and the management of Matata Hospital for the great teamwork that they accorded. I would also like to thank the Department of Health, the County Government of Homa Bay, the Sub-County Healthcare Management, and the United States Agency for International Development, and the Momentum Country Global and Leadership, not forgetting the Midwifery Association of Kenya, for the immense support that they've helped in training and coaching us to achieve these targeted results. Therefore, following the successful and the sustainability that we've implemented for the QI, as a facility, we've really embraced it, and we've decided that we are going to scale this QI initiative program to other programs like the maternal and the newborn health, the child health, and the adolescent health. So our special appreciation to the Webna organizations, University of Nairobi, the Kenyatta National Hospital, Society for Quality Healthcare in Kenya. We are also appreciating our Kenya Medical Association and Kenya Association of Physicians for the opportunity to share our learning. Asanteni.
Thank you. Thank you very much, Christine, especially for sharing that practical example of quality improvement and also the interventions you're able to put in place and the measurement and the evaluation. I know it puts things in perspective for us, for those of us who are considering taking up quality improvement initiatives within our departments, within our clinics and hospitals. We also appreciate the teamwork that really came out for me in your presentation in being able to successfully implement these interventions. Allow me to just ask a few questions from the audience. I'll start with Milan. I think Milan, you've had a sip of water. So Zakaria asks about health system challenges and particularly hospital leadership here within the hospitals and both nationally and in the counties. So how does this impact our quality improvement initiatives?
Yeah, thank you, Dr. Brenda. I think that management commitment is key, and that is why even in my presentation, I said one of the critical factors is management commitment. Now, we have benefited from this learning experience, and I'd want to share our organizational learning experience. There are three ideas that I can share. I will not say I'm a monopoly of knowledge on that particular space, but this has worked for us. The first one is to be able to involve management representation in the quality improvement team. Sometimes we keep them out and we do our thing here. By the time we take to them the ideas on policy making table, then they are exotic ideas that they didn't participate, they don't have a representation, and therefore it looks alien to them. So management representation in QIT, even if they are not leading the QIT, they are members to be able to have insight and also borrow from knowledge of management and borrow from knowledge of QIT to be able to make sure that you have a middle ground that is politically neutral to be able to help achieve these objectives. The second thing that you can be able to do is sometimes to bite small and also have big impact. I know when it gets to management and leadership, involvement is usually about the figures. They want to know how much does it cost. Quality is not cheap. Quality is expensive, and that is a fact because quality is everything. If you want to make everything right, then the budget definitely will not be sufficient, but just a deliberate effort to have some cost that would be affordable, sustainable. So start small, show the impact, bring up the results. If you want to have the buy-in of management, show them where the money is, whether direct or indirect. So show how this has got either grandier picture or has got a direct impact at a micro level. So I think those two are critical. And the third one is that sometimes also acknowledging their participation and their support is also very important, because sometimes we take it for granted. The management has been able to provide certain resources to be able to achieve an idea that we have conceptualized and have in the quality project. But then once that is done, we feel that this idea is just the QIT or the quality improvement team, and the management had no role to play. So I think acknowledging management support helps also have the buy-in of the members and trust that the management has got a deliberate effort and commitment to issues quality. But lastly, also when we are providing our information to management and our reports, we should not just give rumors. We should be able to give benchmarked findings, reference literatures, and also do our either desktop research or be able to do a survey or basically just get knowledge from other same level facilities and how they do it. So that basically makes sense for management.
Wow. Thank you. Zakaria, I hope you have those 3 pointers. Let's involve the management. Let's have that rational budget, and let us acknowledge their input and their participation. Asante. So Christine, let me direct this question from Angela to you. Angela is asking if you considered interventions antenatally and also which methods were preferred. That's from Doris and Angela. If you can take those two questions.
Thank you, Brenda. The first question, we considered, we started on group NCs antenatally. We also did individualized counseling antenatally, and therefore we were writing on our booklet. When the client comes on for ANC, we counsel her on the family planning methods that are available and the family planning method that she can choose and can be administered immediately after delivery. So we also did a group NC whereby we counseled and health educated a group of clients coming for antenatal. And the method that was mainly considered by these clients were JADEL. We tried initiating postpartum IUD. Most of these clients had serious myths and misconceptions from the community. You'll find that most of them would complain maybe it would bring infections. Maybe their spouses would feel it during their times. So what we did, we reassured them and we counseled them thoroughly. But we realized that most of these methods the main method that has been taken by these clients is JADEL.
Okay, so I'm assuming Doris and Angela are working in that area and are informed. Thank you so much. I see a question about your presentation, Christine. Just clarification for Bernard. You had a slide on predictions. So Bernard is asking if those were predictions or evaluation. So as yes, as Christine is taking that question, I think she's getting to her slides. For those of you who have not received your CPD from the KNHUN webinar, just know that that matter is noted and the admin are working on it. You will be updated. I think some cadres through their consoles may have some delays. So that is noted. The presentation will be shared with you to your email as soon as the presenters avail it to the admin. The email that you registered with for this webinar, so you'll be able to access the presentation. The recording is available on the KNHUN YouTube channels and will also be available on the KMA YouTube channel. So look out for it there. Yes, Christine, are you ready to take that question?
Bernard, on
I think we've lost you, Christine.
We've had it. So, but those were some of the key lessons that were learned.
Okay, thank you. So those are key lessons learned from this quality improvement process that Christine has shared with us. I don't see any other questions. Oh yes, there's one more question I see from Abdirzak. Milan, maybe is there an assessment tool or checklist that facilities can use to assess QI? And based on the findings, we will be able to ask for management support. So any recommendation on assessment tools? I know you shared some in your presentation. Maybe you can highlight that again.
Yes, so there's a 5S+1 that includes safety checklist that you can be able to access online. Then this can be able to be used to because it gives us score systems. But at the end of the day, it gives you a tally out of 100, which you can be able to assess the 5S preparedness of that particular unit. The other tool for QI could also be the EKQMH tool, which is available through the ministry, or just the hard copy KQMH checklist, which is also available online. You can download it through the MOH platform. Yes, so those are methods that you can be able to use.
Thank you. Thank you, Milan, for that. Olabisi asks, and this question is for Christine. What was the final result from a baseline of 2%? Where did you get to? And well done for that great QI project you're running. Christine? Okay, so allow me to just highlight one of the take homes I'm picking from the attendees. Anonymous attendee says that with quality improvement, every intentional action counts, even where we are hard pressed on finances. Yes, thank you for that, anonymous attendee. So we'll do intentional actions in a sustainable manner, as we've been taught today. So Maria Mulwa asks, how do you track progress during implementation to know whether you are on course or off course? Maybe you can help us with that, Milan, on monitoring. Milan?
Yeah, for starters, you could also check your budget. So you could make sure that you have got a budget, and then this budget, you look at the budget performance in quality. How have you been able to utilize this particular budget? So that's one. So basically it tracks that, and also how you report on the project. Number two, there's also accountabilities that you also have from the committee that you have for quality improvement as well as management. Number three, there are run charts that you can be able to have. Examples have been showed to us that you identified the problem through 5S. You have done root cause analysis to this particular problem. You have an intervention. You have sorted the problem out, and therefore you want to say, okay, this is where the problem was. This is what interventions we made. How are the results? Are the numbers declining? Are the numbers increasing? Depending on what you're basically looking at. So those trend charts can be able to also show you whether you are on course or off course. Thirdly is also outside review. You get a third-party review. A good example is that the QIT would be a third-party review within the institution internally. Sometimes you just also have peer benchmarking. You basically just have surgical units just coming to just look into maternity services, and they can be able to give you what they think, and therefore you can be able to have a way of improving. Next time you have a joint meeting, then the rest of the clinical team can be able to tell you whether progress has been made on previous action points or their lack of. So that's something that you can be able to make sure that happens. And also just making sure that you have got either a tracker form for issues, incidences that have been identified. These incidences, a tracker form would be able to make sure that complaints or concerns or items or red tag items that have been identified have been marked correctly to the right personnel. And when you come for the next audit, we can be able to hold the previous personnel that was marked this particular item to act on responsible for not acting on that particular issue. So there are a number of opportunities that you would have to be able to track whether you are performing or not.
Thank you very much. Thank you to Milan and Christine for a very insightful presentation. This has been a great learning platform. I see we have the chair of the Society of Quality Healthcare, Dr. Lydia is here. And I'd like to give her a chance to maybe say a word before we close. Dr. Lydia?
Thank you very much. Truly insightful. Thank you, Milan and Christine, for sharing your experience. And it goes a great way in just enabling us know that this can happen and we can take these skills and tools and use in our workplaces. I just wanted to add something concerning what Milan has shared, that we can institutionalize the 5S Kaizen in our institutions, and where we have any quality management systems, we can have that as part of the performance measure. For example, in KNH, I think for any internal quality audit, it's expected that part of the measures are to do with how we performed on 5S, because it is the beginning of quality improvement to make our workplace be neat and to make them be safe and be clean. So I think 5S Kaizen is perverse, and I would encourage institutions to take it as an entry. But when it comes to other advanced measures for quality improvement, if it is a project, as Milan has mentioned, having something that can help you know the milestones. If your first milestone was to compose a committee and then to explore the issue, that can be, it can make you know that you're on track, because it has a beginning and an end, and it has a time where you hand over the initiative, what worked and what did not work. So success in quality improvement is being able to run the whole haul and then being to submit a report. Of course, if there are safety concerns, you can change track because it is iterative, but it's very good to have milestones, and the lessons that are learned could be that we should not try this in this manner. So the completion of QI enables the institution to know how next they can improve on a certain issue, even if it had moderate or just a little improvement. We can know that next time we'll iterate with a different approach. So I think those are very great presentations by the two members of the quality space. And we also appreciate your institutions for enabling you to share your insights for the country. Thank you very much. And thank you, Brenda, for moderating.
Thank you very much, Chair, and thanks for that wrap up. So now I'd like to close this session and invite you all to look out for future webinars under the quality series. The healthcare quality series, we'll be advertising it on various platforms and definitely through the KNH-UN webinar platform. Your matters on the CPD have been raised and the team will look into it. For those of you who wanted the recording, please check the various YouTube channels. You'll be able to access the recording there. Have a good afternoon. Bye-bye.